Hello, everybody, and welcome to our question lab. Thank you guys very much for joining us today. Before we begin, I do want to introduce some people. As you guys know, we'll be talking about epidemiology today. We're doing epidemiology because it is an important topic. It's something that students often put off a little bit, but if you look at the news, you're seeing a lot of talk about some of these epidemiological topics, and we want to cover those today and give you guys a good review, while also sharpening some of those test-taking skills. Leading our discussion today is Dr. Abraham Titus. I'll let Dr. Titus introduce himself.
Hi guys, nice to meet all of you guys. My name is Abraham Titus. I'm a resident physician at Marshall University studying internal medicine. I've been with USMLE-Rx for over a year and I have had several hundred tutoring sessions and helped many students achieve their goals on step one.
Excellent, and we have some wonderful panelists that will be helping to answer your questions. If you look at the right side of your screen in the GoToWebinar panel, you'll see a box that says questions. So you can type your questions in there. We have some wonderful panelists who will try to answer those questions for you. I will introduce some of those panelists for you here before we begin. So one of those is Dr. Christine Lemigwin.
Hi, everyone. My name is Dr. Christine Lemigwin. I'm an assistant professor of pathology at Lake Erie College of Osteopathic Medicine. I've been working with USMLE-Rx for almost 3 years now and have been helping a lot of students with their board prep goals. So shoot us any questions if you have any.
We keep talking about RX Coach. For those of you who are not familiar with RX Coach is our new one-on-one tutoring program. It's an individualized approach, and we work with you one-on-one to help you maximize your potential while you're in medical school and on test day for your board exam. So we'll talk about that a little bit more, but without much further ado, I do want to go ahead and get into our questions. But before we get into questions, you had a chance to get to meet us and some of our panelists. We'd like to see who you guys are out there today. So I'm gonna put a little question up on your screen, and feel free to select an answer so we can get an idea of who is in attendance today. So these polls will be showing up throughout the webinar for every question, so you guys can answer and select your answer choice when we're doing these questions. So familiarize yourself with the screen. Excellent. So it looks like we only got a couple people that responded. We'll give you guys a couple more seconds to select and answer which exam are you currently preparing for. All right, looks like we've got about 2/3 of you guys in. So let's see who we're dealing with today. So it looks like about 94% of you guys are studying for step 1. We've got some CBSA students, COMLEX, step 2, as well as school exams. So welcome to everybody, and thank you guys for joining us. As you guys know, or you guys may not know, we're doing these question labs once a week, every Tuesday at 6 p.m. Eastern time. Today's epidemiology, and next week we'll be covering biochemistry. So let's go ahead and get into our question dissection. So we'll begin with our first question of the day. Now, as you guys can see, you see the question, but you guys don't see the answer choices, and that's by design. We're using today the same approach that we use in RX Coach, the same methodology we use there. And the first thing we like to do is cover up those answer choices. And the reason we do that is because we do not want these answer choices to guide your thinking. We don't want them to dictate your thought process. And we definitely don't want you to see an answer choice that you're unfamiliar with, causing you to panic before you even read the question. So we've got those answer choices covered up for you. And after we cover those up, we will read the last sentence or the lead in first. Which calculation would give the probability that the positive test result is actually positive? Now, after you read this, you should start thinking about how many steps this question is going to take you to answer. So an example of a one-step question could be where they ask you for a diagnosis. An example of a two-step question could be where you're asked for a treatment for a diagnosis. And an example of a three-step question could be where they ask you what is the mechanism of action for a treatment for a diagnosis. So it's good to have that so you map out your thought process a little bit. And after you do that, we're going to go ahead and start reading the question together. Now, normally in our coaching sessions, we will stop you after every sentence and ask you what you're thinking and make sure you're picking up on the right clues and not getting distracted by the distractors. Since we can't do that with all of you individually today, I'll pause briefly after every sentence so you guys can gather your thoughts. So which calculation would give the probability that the positive test result is actually positive? A new test has been developed to diagnose streptococcal pharyngitis and is being compared with the gold standard, rapid strep swab to determine its efficacy. 1,500 patients have been randomly selected from a population to complete the study. When the rapid strep swab is used, 750 of the 1,500 participants are found to have streptococcal pharyngitis, whereas 750 do not. With the new testing method, 600 patients with streptococcal pharyngitis tested positive, and 50 patients who did not have streptococcal pharyngitis tested positive. Which calculation would give the probability that the positive test result is actually positive? And with that being said, I'll hand it over to Dr. Titus.
All right, guys. So what I'm going to do right now is I'm going to read the options from E to A. This is an approach that we always use when we deal with these questions, just to avoid any traps that the test writer might have written, expecting us to read from A to E. Right, so I'll start reading them off, and then we'll give you some time after to pick an answer from the poll. All right, so option E, 700 over 700 plus 150. D, 700 over 50 plus 700. Option C, 600 over 600 plus 50. Option B, 600 over 600 plus 150. And option A, 600 plus 150 over 600 plus 50 plus 150 plus 700.
Excellent. I know that we have a lot of numbers here, and it might be helpful for you guys to grab some scratch paper for subsequent questions, especially for our third question today. So I'll give you guys a minute to take a stab at this and select an answer. Don't worry if you don't get it right. Our goal here is to teach you so you guys know this material on test day and get it right when it matters. So I'll give you guys a couple more seconds to select an answer. I can see that only about 25% or so of you have actually selected one so far. If you don't know what the answer is, feel free to take your best guess, and we'll review the correct answer as well as the incorrect answers together afterwards. All right, well, looks like we're making some progress here, and a lot of you guys are on the right track, so good work so far. All right, let's see what you guys selected. Looks like about 51% of you guys selected answer choice C, and second runner-up was answer choice B, with 24% of you guys selecting answer choice B. So let's see what the correct answer is. The correct answer is C, 600 divided by 600 plus 50. And I will let Dr. Titus explain the correct answer as well as the incorrect choices.
All right, so before I jump into explaining the answer, I have a question for you guys. What is this question really asking us? It says the probability that the positive test is actually positive. So I want you guys to type in what you guys think in the question box, and I'll give you guys a few seconds to do that.
So that same question box where you guys can ask our wonderful panelists questions, go ahead and input what you guys think, just so we can have a little bit more interaction and see what your thought process is like. And it looks like we're getting some good responses.
Very good.
Excellent. Looks like we're dealing with a pretty smart crowd today. So go ahead, Dr. Titus.
Yeah, so exactly. So as a lot of you have been saying, it's asking for positive predicted value, right? So whenever a question says the positive test result is actually positive, so a lot of P's there, right? Positive predicted value. Okay, does anybody know the formula for positive predicted value? The formula is true positive over true positive plus false positive. So you guys got to memorize that formula, keep it in the back of your mind every time you hear positive predicted value. So now what are these values? What is true positive? What is false positive? That's the next step. So as we look in this question here, 600 patients who tested positive for strep actually have strep. So that would be our true positive, right? That's the first step. We got our true positive. So the top number has to be 600. Right, the formula is true positive over true positive plus false positive. So we got 600 over 600 plus. So how do we find out what false positive is? Well, false positive is the people that tested positive but don't actually have the disease. So just like how we said that, 50 patients who did not have strep tested positive. So those are your false positives. So the answer would be 600 over 600 plus 50. So let's look at some of the other options. Option E, 700 over 700 plus 150. Well, we know 700 is not true positive, and we know 150 is not false positive. So that way we can eliminate options E. Just like that, we can also eliminate options D. And this is a very close option. They give you the true positives correct, but the false positive does not match up. 150 is not the false positive, 50 is false positive. And options A, well, that doesn't make sense. All right, so I think you guys got the hang of this question. Next time you see something like this, when they say the probability that a positive test is actually positive, that's positive predictive value. If they say probability the negative test is actually negative, that's a negative predictive value. So just get used to using these terminologies and understanding what they're asking for.
Excellent. So, we started off with a rather simple question. A lot of you guys actually got it right, which is great. So there's not a lot of explanation there because there's one formula you guys have to know and then employ here to get that correct answer. So great job. Let's move on to question 2. Once again, you will see that the answer choices are covered up. And for those of you just joining us, we do that on purpose so you guys aren't distracted by the answer choices. So you guys don't let them dictate your thought process. And so that you don't see an answer choice you're unfamiliar with and allow yourself to panic before even reading the question. After we do that, once again, we're going to read the lead-in or the last sentence first. Which range of blood glucose would account for 95% of the participants in the study? And now we will read the question stem. A study involving 1,000 patients with diabetes was performed to determine their average blood glucose. The patients in the study are all compliant with their medications and lifestyle modifications. The average fasting blood glucose was found to be 120, with a normal distribution and a standard deviation of 10. Which range of blood glucose would account for 95% of the participants in the study? Dr. Titus.
All right, and just like last time, we're going to start with option E and make our way to A, just to avoid any traps that the question writer has laid out for us. Option E, 90 to 150. Option D, 120 to 140. Option C, 110 to 130. Option B, 100 to 140, and option A, 100 to 120.
Excellent. So I'm going to open up a poll and give you guys a minute to select the answer that you believe is correct. I know you guys probably are figuring that out as we speak. So here's the poll. Please take a moment to select what you believe is a correct answer, and then we'll go over this together again. So on the exam, you will actually be given 2 sheets of laminated paper with a marker. And so you'll be able to use that as scratch paper and to take notes during the exam. And you'll actually be able to turn that paper in once you've written on both sides of it and actually ask for a replacement. So you can get 2 sheets at a time with the marker, and you'll be able to switch those out so that you guys can have scratch paper to use during the test. A lot of students don't use it. A lot of you guys like to think out loud by writing, so that's completely fine. But they do come in helpful and handy when you're doing math problems or dealing with epidemiology. So just keep that in mind. All right, looks like about 2/3 of you guys have voted, and let's see how you guys did. Looks like about 48% of you guys picked answer choice B and 39% of you guys picked answer choice C. So pretty close split there. Let's see what the correct answer is. The correct answer is B, 100 minus 140. And with that, I will turn it over to Dr. Titus.
Good job, guys. So majority of you guys did get it right. So the big thing to take away from this question is they say in the question, it's normal distribution. So they say 120 with a normal distribution and a standard deviation of 10. So those are the buzzwords here to take away. When you hear the word normal distribution, I want you to think of the Gaussian bell curve. So that's the classic symmetrical bell curve that you have to picture in your mind. And 3 values that I want you to remember, no matter what, is 68, 95, 99. So that's, I want to repeat that yourself. 68, 95, 99. Right. So 68% of people will fall within 1 standard deviation. So that means plus 10, minus 10. 95% of people will fall within 2 standard deviations, plus 20, minus 20. And 99.7% of people will fall within 3 standard deviations, plus 30, minus 30. In this case, where am I getting these numbers from? Standard deviation is 10. So 1 standard deviation is 10 times 1. So plus 10 minus 10. 2 standard deviations is 10 times 2, 20, plus 20 minus 20. And 3 standard deviations is 10 times 3, 30, plus 30 minus 30. So in this case, we're dealing with 95%. So that is 2 standard deviations. So what is 2 standard deviations above 120? Or 120 plus 20, that's 140. And 2 standard deviations below 120 is 120 minus 20, which is 100. So the numbers I want you to remember, 68, 95, 99.7. So if you guys can remember that much, this question becomes a lot easier. You can approach these questions in a much more organized fashion. So let's look at the other options. Option B is the correct answer. We just talked about that. Option C, on the other hand, a lot of you guys picked that. That's actually a really good option, but notice it's only 1 standard deviation. So if this question said would account for 68% of participants, well, option C would have been correct. Let's look at some of the other options. Well, option E is another good option. You see that? That's minus 30 plus 30. That is 3 standard deviations. So if they said would account for 99.7% of participants, you could pick option E. And option D and A, on the other hand, do not fit the scenario, so they don't have that symmetrical. Okay, so what we want to do here is we want to always approach these questions in a systematic fashion, start with E, work our way to A, and eliminate the incorrect options and choose the correct option.
Excellent. Good job, guys. I know only 48% of you guys got it right, but that's okay. Remember, we're here to learn together. And with some of these questions, as long as you can pick up on those clues, like the standard deviation of 10 to 95%, when you can get those clues, these questions become rather easy to answer because all you have to do is find that formula and plug in those numbers. So let's move on to our next question. But before we do that, I want to tell you guys a little bit about RX Coach, and be sure to stick around after the last question because we're going to give away some free stuff and we have a special offer for you. And we're going to have a couple lucky winners that are going to get some free resources. So be sure to stick around. You must be present to win. So Jeff will pick some names here at the end of the webinar. So our RX Coach program starts off with a 160 question assessment. So we can start to gauge your strengths and weaknesses. Once we have that, then we help you develop a personalized study plan. And then we have this one-on-one approach with these highly trained RX certified tutors like Dr. Titus and like Mark Heslin, who's on the call today. And all of our packages do include access to RX 360 and RX Bricks. So we work on knowledge. We want to bridge those knowledge gaps. We want to work on your content and strengthen that foundation. But we also want to work on test taking skills and try to see if there's a pattern as to why you're missing questions so we can help you maximize your potential on testing. As you can see, we have a wonderful testimony here from one of our students. Since starting my sessions with RX Coach, my USMLE preparation has been more enjoyable and significantly more productive. The question techniques and material that my coach has taught me has improved my QMS percentages by over 15% and increased my overall scores. My coach is a great teacher who takes the time to explain topics clearly, efficiently, and in a way that is memorable. For anyone who is serious about doing well on the USMLE, I would highly recommend RX Coach. Wonderful. So let's move on to our third question. Once again, our answer choices are covered up and we will read the last sentence first. Which of the following is an appropriate conclusion to draw from this study regarding cell phone use and brain cancer? Researchers are investigating the relationship between cell phone use and brain cancer. Of the 50 participants who have brain cancer, 30 were found to have used a cell phone for 10 years or longer. Of the 400 participants who were not diagnosed with brain cancer, 250 were found to have used a cell phone for 10 years or longer. Which of the following is an appropriate conclusion to draw from this study regarding cell phone use and brain cancer? Dr. Titus.
All right, so this question, you guys might need your scrap paper for this, so I recommend getting that out, using what you need to. Take your time with this question, as it does require a little bit of extra time. Okay, so I'm gonna go read the options from E to A, just like how we explained before for the people that just joined. We're gonna do that to avoid any traps that the test writer may have laid out for us. Option E, the relative risk of cell phone use is 8/3. Option D, the relative risk of cell phone use is 3/8. Option C, The odds ratio for cell phone use is 9/10. Option B, the odds ratio for cell phone use is 10/9. And A, the attributable risk for cell phone use is 1/40.
Excellent. We'll give you guys a couple extra seconds on this question because it does require a little bit of legwork here to figure it out. But hopefully you guys will have a good thought process. We'll be able to go over all of these together. This is one of those situations where your scratch paper is going to come in handy. And like I mentioned, you will get 2 on test day. I know we talked about RX Coach already. At the end of this, we're also going to be reviewing and showing you, or previewing rather, RX Bricks, which is one of our new resources that you guys can take advantage of. If you guys are interested in RX Coach and learning more about our tutoring program, you can visit rx-coach.com to schedule a free consultation to learn more about our tutoring program. If you're interested in generalized tips and resources, or you want access to a free study planner, please visit firstaidteam.com. So once again, it's rx-coach.com if you're interested in working with a tutor to maximize your potential. Please schedule a free consultation so we can talk more about it and how it can help you maximize potential on test day. It looks like we've had about a third of you guys answer. I'll give you guys a couple more seconds. And like I said, if you guys don't know the answer, or if you guys are just completely lost, feel free to take your best guess, right? There's no wrong points, or there's no penalty for guessing on test day. So you don't want to leave any questions blank. So it looks like about half of you guys have answered so far. We'll give us a couple more seconds and we'll see how everybody did. All right. Well, let's take a look here and see what you guys came up with. Looks like 41% of you selected answer choice D, the relative risk of cell phone use is 3/8, and 25% of you guys selected C. So let's see what the correct answer is. The correct answer is C. The odds ratio for cell phone use is 9/10. And with that, I'll turn it back over to Dr. Titus.
All right. So don't feel bad if you got this question wrong. This is a little tricky of a question. So you guys, the big thing what you want to take away from this question is, what is this question asking you, right? So I'm going to repeat the last sentence one more time. Which of the following is an appropriate conclusion to draw from this study regarding the cell phone use and brain cancer? So we want to know what kind of study we're trying to use from this, right? So in the question thing, I want some of you guys to type out, what study are we looking at? So what kind of study are we looking at? I'll give you guys a couple seconds to do that. Okay, I see a few right answers. Right, so this is a case control study. That's the first step in diagnosing or getting the right answer. We see that they're talking about people with brain cancer and people without brain cancer. So I want you to think of it as cases are people with brain cancer. And we're comparing them to healthy individuals who are our controls. Whenever we deal with situations like that, when we're comparing people with a case and without a case, we're using case control study. And whenever you hear case control study, if they say what can we use to study this, we're going to use odds ratio. So odds ratio, case control. Make that association in your mind, guys. When you hear case control, it's going to be odds ratio. All right. So the next step is, what is odds ratio? Well, there's a formula you have to know for that. The formula for odds ratio is going to be A/C over B/D. Okay, what are these letters I'm talking about? Well, if you guys use your paper correctly, you guys would have drawn the square out. You guys know what I'm talking about? The risk versus disease square. Right. So what we're going to do here is, since I'm not here with you guys and it's a lot of you guys, I'm going to just explain how to draw the square and we're going to take it from there. So right, we want to do the square with the disease on the top and the risk on the side. We can do 30 as A, 250 would be B. So let's explain how we got that. So 30 is disease positive and risk positive. Well, the people that have brain cancer and have the risk of using cell phones is 30. So that's A. We assign that to A. B is the people that don't have the disease and people that have the risk factor. So people that would be 250, right? People that are risk factor is cell phone use, whereas people that are healthy is normal. So that would be B. C is people that have the disease, but no risk factor. So that is what's left over. 50 participants, right? 50 people have brain cancer. So 30 minus 50 is 20. So 20 is the amount of people that have the disease, but no risk factor. Are you guys following along? Okay. The final thing we're doing is D. D is the people that don't have the disease or the risk factor. The final thing is people that don't have the disease or the risk factor. So people that don't have the disease, people without brain cancer. So we're talking about the total 400 people, right? And people that don't use that would be minus 250. 400 minus 250 would give us 150. So see what I meant? This question takes a little bit longer than the rest. It takes you some time to get all this calculation down and get these values down. Okay. Once you got this, it's a lot easier. So once we have our A, B, C, and D, we've mapped everything out. We've got our numbers now. All that's left is plug and chug. Plug it into the formula, and you got the answer. So the easiest way to remember the odds ratio formula is A times D divided by B times C. You guys might have seen that in your first aid. That's the simplified version of the odds ratio formula. So A, in our case, is 30. So 30 times 150 is going to be our top part, divided by 250 times 20. AD over BC. So as you guys can see, Shan's going to write it out here. AD over BC. Perfect. So let's do this. So this is going to require some math here again. So I want you guys to follow along. So A, in our case, is 30. D is 150. And then B is going to be 250. And then C is going to be 20. Perfect. So I'm just gonna, for the sake of time and simplicity, we'll just kind of do this, the math quickly. So 30 times 150 will give us 4,500. And 250 times 20 will give us 5,000. So we're dealing with two big numbers right now. We want to simplify that to a much smaller number. So we can take out the zeros, which will give us 45 over 50. 45 over 50, even simplified even further, will give us 9 over 10. If we divide both the numbers by 5. So if you guys followed along, the first step what we did was we decided this was an odds ratio question. How do we get that? We said it was a case control study. Just by understanding that there's a case in the situation, which is brain cancer, and the control is a healthy population. So understanding that is a first step. Once you know it's an odds ratio you're looking for, then you go, okay, I know the odds ratio formula. Let me find my A, B, C, and D. Then let me plug it in. That is how we want to approach these questions, right? Let's look at some of the other options and make sure, check why would that not be the right answer. So option E, the relative risk for cell phone use is 8 over 3. Well, we're not calculating relative risk. A relative risk is calculated when we need to use cohort study, when we're comparing risks. So in this case, we're comparing people with disease and without disease. On the other hand, if we're comparing people with risk factor and not risk factor, that would be a relative risk. We have to use that to calculate a cohort study. Option D, same thing, relative risk. We're not calculating relative risk, so we can ignore those guys. Option B, well, that's the flipped formula. So that's if you did BC over AD instead of AD over BC. So B is incorrect as well. And A is attributable risk. Attributable risk is very similar to relative risk, except we're going to be dealing with subtraction. So if you guys look through your first aid chapters, you guys can see the formulas and really understand when to use them and how to apply that. But in this situation, it's a case control study, so we have to remember it's odds ratio.
Excellent. So, once again, we had a challenging question there, but you are going to have some challenging questions on test day. So it's important to do it step by step, just like Dr. Titus showed you. And like I said, if you guys got it wrong, don't worry. We're going to get it right on test day. That's why we're doing this. And once again, if you guys need that extra help, you guys want that extra coach and that one-on-one study plan, you want somebody to help identify what you should be doing, how you should be doing it, what your knowledge gaps are, and how to finesse your test taking skills, be sure to visit rx-coach.com and schedule a free consultation to discuss our tutoring program. We'd be more than happy to tell you more about it. So we're going to do our last question now, and after our last question, we're going to do a raffle and give away some free stuff. So make sure you stick around. And with that being said, let's get into question 4. Once again, you'll notice the answer choices are covered up, and we will read that lead-in together. Which of the following errors was most likely to occur if the age difference between the two groups went unnoticed? A new antihypertensive medication is being investigated in a double-blind clinical trial. Patients representative of the general population were recruited and enrolled in the study. Investigators have noted a decrease in blood pressure in the group treated with the new drug compared with those in the placebo group. While examining the study's participants, investigators noticed that the experimental group has a lower mean age than the control group. After realizing this, the investigators stratify the groups by age. Then they repeat the same study. The investigators again find that among those treated with the drug in both the younger and older groups, there are significant decreases in blood pressure. Which of the following errors was most likely to occur if the age difference between the two groups went unnoticed? Dr. Titus.
All right, so same thing like before. We're going to start with option E and make our way to option A. Option E, systematic error. Option D, sampling bias. Option C, effect modification. Option B, confounding error. And option A, a type 2 error.
Excellent. So we'll give you guys some time to select your answer choice here. There's no math involved here, so this one should be more straightforward. I know we had a couple of these where we did have some math involved, and this took a little bit longer, especially the last one, but that's okay. Hopefully it was a good learning experience for all of you. So we're still waiting on some more of you people to, some more of the participants to select their answer choices, and then we'll review it together, preview a brick, and then give away some free stuff. So hopefully you guys are excited, and 2 of you guys will walk away lucky winners. Looks like we've got a pretty even split here so far. If you guys aren't sure, please take your best guess, and we'll go over this together. And as you guys know, if you guys are watching the news, these topics are coming up pretty regularly, so it's a good time to review these and make sure that we have these concepts under our belt, not only for now, but for test day and hopefully one day eventually in practice. All right, looks like about 2/3 of you guys have answered, so let's take a look and see how you did. Looks like 37% picked sampling bias and 35% picked confounding error. Let's see what the correct answer choice is. The correct answer choice is B, confounding error. So once again, it's a little bit of a challenging question, it seems, but that's okay. Dr. Titus is going to explain it to us and explain the other answer choices to you as well. Dr. Titus.
Thank you, Shan. So another tough question here. So here, it's all about the terminology, understanding what does confounding error really mean? What does sampling bias really mean? What does effect modification really mean? So that's what this comes down to. So when we look at the study, they're comparing people, that are taking one blood pressure medication versus not taking blood pressure medication. So in this situation, they realized that there was a difference in age group. Age in this situation was a confounding variable, right? And the key word here is stratification. What they did was they stratified the patients and redid the study. So understanding the word stratification, stratifying a study prevents confounding. Understanding that is the key to answering this question. Okay, so what is confounding? Well, confounding is a type of error you get when the factor is related to both the exposure and the outcome. Well, that sounds really complicated. Well, think about what's happening, right? As you get older, people tend to have a higher blood pressure. So age is a confounding factor. For example, if we're testing in a different situation, let's say alcohol and cancer. Well, if we don't stratify for smoking, smoking is the confounding variable. We have to take that into account. Does that make sense? So that is the confounding error in this situation. If they're saying if they did not notice this, that would be the confounding error. Right, let's take a look at some of the other options. Option E, systemic error. Well, systemic error is an error in the actual study itself. If there's a problem with the equipment, if they're not measuring certain things properly, the error itself is the issue. So that's not the correct answer. Sampling bias. A lot of you guys pick sampling bias, which is not a bad answer, but it's not what's going on here. A sampling bias would be if, let's say, we are trying to, the sample chosen for the study is not a good representation of the overall. Let's go to a gym and we're gonna take the people's blood pressure of the people at the gym, and we're gonna say that relates to everyone else in the population. So it's not a good sample. Or we're only checking people's blood pressure at a hospital. So people at the hospital are usually sick. They'll have worse blood pressures. That's not a good sample for the general population. So that's when they usually go towards sampling bias, understanding that the sample you're testing is not a good representation of everybody else. That's not what they're talking about in this case. They're talking about particularly the age difference. They're understanding that the age is the confounding variable. Effect modification would have also been a good option. But why is that wrong? Well, effect modification is when you're aware of the change. In this question, they're asking, which of the following errors was most likely to occur if the difference was not noticed, was unnoticed? The unnoticed part makes it not effect modification. Effect modification, you're aware there is something modifying it, either positively or negatively. But the fact that it's unnoticed would make it a confounding error. And finally, A, type 2 error. Type 2 error is, the idea of type 2 error is there's thinking there is not a difference in a study when there actually one exists. And this usually happens due to a lack of power of a study. So what is power? Power is usually determined by the number of people in a study. So there's more people in a study, the more powerful the study, and the less likely a type 2 error is going to occur. So in this case, they're not talking anything about the fact that there's only 10 people in the study, or there's very few people in the study. If they mention anything like that, then you think, okay, maybe there's some type of problem with the study. Here, there's a double-blind clinical trial. So it's a good study, and there's nothing wrong with type 2 error. That's how we approach these questions, and that's how we want to answer this question.
Wonderful. So well done once again, Dr. Titus. Thank you for the explanation. And hopefully you guys learned from it. These are important concepts that are going to keep coming up. So it's important to know them and familiarize yourself with them.